Today, we're diving into a topic that could save lives: cervical cancer. It's a disease that doesn't get talked about enough, yet it affects millions of women globally. This video is here to empower you with knowledge about prevention, early detection, and treatment options. So grab a seat. It's time to take control of your health. How does cervical cancer develop? Cervical cancer begins silently. It starts with abnormal changes in the cells of the cervix, which is the lower part of your uterus that connects to the vagina. These changes are often triggered by infections, most commonly the human papillomavirus, or HPV. When the virus persists, it can cause damage to the cervical cells over time. If left untreated, these changes can progress to cancer, often without any warning signs. What are the causes and risk factors of cervical cancer? So, what puts you at risk? The number one cause of cervical cancer is HPV, a very common virus that's transmitted through intimate contact. In fact, nearly all sexually active individuals will encounter HPV at some point. But don't worry, not all HPV infections lead to cancer. Other factors that increase your risk include smoking, having a weakened immune system, multiple full-term pregnancies, or a family history of cervical cancer. Are you wondering where you stand? Keep listening. How is cervical cancer diagnosed? Now, here's the game changer: regular screenings. The Pap smear and HPV tests are your first line of defense. These simple, quick, and painless tests can detect early changes in the cervical cells before cancer even develops. Experts recommend starting Pap tests at age 21 and combining them with HPV testing after age 30. Regular screenings could be the difference between catching something early and facing a more serious diagnosis later on. If cervical cancer is detected, there are several treatment options depending on the stage. In the early stages, surgery to remove the cancerous tissue may be all you need. For more advanced cases, treatments like radiation therapy or chemotherapy may be recommended.